Psychopharmacology is the study of how drugs affect the brain and behavior. It focuses on the use of medications to treat psychiatric disorders such as depression, anxiety, schizophrenia, and bipolar disorder. This field combines principles of pharmacology, how drugs work in the body, and psychology, how they impact mood, cognition, and behavior. Key aspects of psychopharmacology. Heavy checkmark mechanism of action, how drugs interact with neurotransmitters like serotonin, dopamine, and GABA. Heavy checkmark drug classes includes antidepressants, antipsychotics, anxiolytics, mood stabilizers, and stimulants. Heavy checkmark side effects and safety, monitoring adverse effects and drug interactions. Heavy checkmark clinical applications, how medications are prescribed for mental health conditions. Heavy checkmark research and advancements, new developments in psychiatric medication. Case study managing major depressive disorder with antidepressants. Patient profile. Name Mr. A. Age 35 years. History persistent low mood, fatigue, loss of interest in daily activities, and difficulty concentrating for the past 6 months. No history of substance abuse or psychotic symptoms. Diagnosis major depressive disorder, MDD, based on DSM-5 criteria. Clinical decision. The psychiatrist decides to start selective serotonin reuptake inhibitor SSRI therapy. The chosen drug is escitalopram, 10 mg per day, due to its efficacy and fewer side effects. Follow-up and drug adjustment. Week 2 mild improvement in mood but complaints of nausea. Week 4 significant improvement in energy and mood, nausea resolved. Week 6 mood stabilized, no suicidal ideation, escitalopram increased to 20 mg per day for optimal effect. Outcome. After 12 weeks, the patient reported a 70% reduction in depressive symptoms. Cognitive behavioral therapy, CBT, was also introduced to enhance treatment. Key learning points. Heavy checkmark SSRIs are first-line treatment for MDD. Heavy checkmark side effects like nausea are common initially but resolve with time. Heavy checkmark treatment duration is at least 6 to 12 months to prevent relapse. Heavy checkmark combination of medication and therapy enhances long-term recovery.